Hello everybody, my name is Dr. Bryan Langlois and I'm the medical director and the staff veterinarian here at the Pet Pantry of Lancaster County. I've also been a member of the Pennsylvania Veterinary Medical Association since I graduated in 2005. And what I'm doing here is just kind of looking over some blood work of one of the resident cats here at the pantry, and beautiful thing is everything looks perfectly right where it should be, right on the numbers as we say. And one of the things we as veterinarians often will ask during a routine health check or yearly visit with your pet is to run just some basic blood work. And a lot of people don't really understand why that may be necessary, why we want to go ahead and do that. And some of them just think it's kind of an extra cost that they really don't need to incur, especially if their animal looks, perfectly healthy otherwise. Why are you doing this? You just told me my animal was healthy. And a lot of it really still has to go with what we're about, which is preventative medicine. We really want to try to prevent issues or catch them very early before they become a major problem and a major expense for you. And one of the ways that we can help do that is by doing this routine blood work every year, or maybe every other year if it's a healthy young adult dog or cat. And by baseline, basically what we mean is we want to kind of see where your animal's levels normally are. And here's what I kind of mean by that. Here's a cute little graph kind of demonstrating normal blood results. As you can see, I'm not exactly known for my artistic ability, but what we're showing here is what is kind of true of any kind of results that we may get when we send blood work off to the lab and result sheet back like this, let's say. And that is this. A normal result for a lot of parameters that we look for can be a wide range, and they fall kind of under what we call a bell curve here. And basically the way they determine normal versus abnormal levels is by taking a whole bunch of clinically healthy animals, let's say dogs in this case, and they're all going to check blood work on them for the same thing. Let's say it's liver enzymes or glucose or something like that. And then they're going to take all of those values that they get and use fancy math formulas and computers and all the stuff that I will never completely understand to come out basically with a bell curve like this, which kind of demonstrates everything that is considered kind of in the normal range. So when we take, let's say, a blood glucose test from your animal and we want to know exactly what it is, the result can fall anywhere under this curve. Let's say this is 0 down here and over here is 200. So anywhere between 0 and, in this mythical case, 200, these are not actual values, would be considered normal for your animal. And a normal range anywhere, if the blood result is here or the result was here or up here, that would be normal. However, there are some animals out there that actually do have normal values that are outside of this bell curve. And we do see it from time to time where, let's say if we're looking for liver enzymes or things like that, their value may sit way out here. But they're perfectly healthy, there's nothing wrong with their liver, this is just where their level is. Or on the flip side, maybe their glucoses are constantly on the lower end of things. And again, perfectly healthy, nothing wrong that we can find, it's just where they sit. This is where what I'm talking about when I talk about baselines comes in very, very importantly. And that is because of this. If we have these values and we know this about your particular animal, if your animal does start showing signs of being sick and isn't doing quite right, we're not quite sure what's going on, and we recommend, let's just take some blood and see if anything appears a little out of whack that might give us a clue as to what's going on, since, again, remember, our animal friends can't really talk to us. And let's say for whatever value we're checking, normally it's always sitting down here. Now, when your animal is sick, that value jumps up to over here. Now, in the bell curve, that's still considered normal. But for your particular animal, that's elevated in our minds. And we might have to look and examine that and investigate it a little bit more to see if that's the cause of what's going on. And if we had not had this baseline and we were doing blood work for the first time on your animal when it just wasn't feeling great, and we saw that value sitting here, we might glance it over and say, you know what, it falls within the normal range, not anything to worry about, when actually really it is. And we don't want to have to put your animal or yourself through any more trouble, financial output, things like that, than we have to when it comes to diagnosing what's going on with your pet. And that is why having these baselines are so important. And, it may seem like a little bit of an added expense at the time, But again, we're talking about preventative medicine, and it really, really is important to maybe have that blood work done. Again, maybe not necessarily every year if the animal appears perfectly healthy. Maybe every 2 years, every 3 years even if it's a young adult. The other thing that's important to remember is you have to, talk to and ask your veterinarian about the different options when it comes to blood work. There are the creme de la creme plans out there, that test for everything under the sun, and there are the more basic ones that cost less money but still give you a very good range of values that you can determine to make sure that your pet is healthy. And of course we always want to see, and 90% of the time or more we do, they're right on the numbers, and that's exactly where we want them. But sometimes also, in that 10% of cases, we may find something, and we may find something that's a little bit off, doesn't look quite right, and we may want to investigate that a little bit further. And what we're doing is maybe finding a problem very, very early that then we can treat very easily, as compared to waiting for it to fulminate and become a real problem that then may require a longer hospitalization stay, a visit to a specialist, and a lot more monetary output sometimes to help that animal. It's very important to remember all of those things. And blood work basically is a snapshot in time. And what I mean by that is that we are evaluating the organ function and red cell counts and white cell counts at the particular time that we take the blood. Which is why if we see something that's a little bit abnormal on a result, we may not jump right into it and say, oh, we've got to start doing x-rays and ultrasounds and all this other stuff. We may say something as simple as, you know what, we need to see him back in a week. We just want to repeat that value and see if it stays where it is, if it's going up, going down. Maybe it was just a little bit of an outlier on that particular test. Maybe the testing equipment was running high that day, something along those lines. And we do see those things from time to time, and then it's nothing to worry about. It's something we know. If we don't do the blood work, we don't know that. So that's, kind of the reasoning behind why we as veterinarians want to try to get that routine blood work to make sure that, everything is okay, and to allow us to compare to when an animal gets sick, if they do get sick and need blood work. The other question that comes up a lot of times is, well, okay, I've heard you say we're just going to run a CBC Chem, a CBC Vet Screen, Super Chem, CBC, there's a lot of different terms out there for it. But what exactly are you, as the veterinarian, or as my veterinarian, this is the owner saying, testing for? And that's a very, very good question, and a very valid question. And there's a lot of different things on these result sheets that we get that kind of go over and determine exactly how your animal is doing from a health perspective. And let's look at some of them and see exactly, what we can determine just from even the most basic of blood screens. And the first thing that we look at on these blood screens is your pet's protein levels. And while it may not seem like a very important thing, it actually really is, because we want to make sure that the protein levels, and we measure a couple of different types of proteins in the blood, are where they're supposed to be for that animal. And there's a couple of reasons that we worry about this if they're high or low. If they're low, one of the main responsibilities of a lot of proteins that are in the system is to basically help keep the plasma and the fluid inside your vessels, keeping your blood pressure up, keeping your blood pressure normal. If you have a very low protein count, a lot of times, you or your pet, you may start to retain water or get some swelling in certain areas. We call it edema, because basically the moisture, the water substance, the plasma that's sitting in the vessels basically is not being kept there anymore, so it leaks out of the vessels into the surrounding tissues. And we would want to know that, because if that number is low, we'd want to know why. And we'd want to start investigate things like, is the liver functioning properly to make sure it's being produced? Are the kidneys for some reason not working right and allowing a lot of that protein to be urinated out when it really shouldn't be? All of those areas that we look at. We also get concerned sometimes with very high protein counts, because that can sometimes indicate some issues, such as a disease called FIP in cats. So we do look at all of those protein values very, very closely. In addition, protein is very, very important when it comes to transporting certain hormones and drugs in the system, as well as some other parameters. So if the protein levels are off, sometimes they can affect the levels of other things and electrolytes that may be in the system that are transported or bound to protein when we look at those things. The next thing we kind of look at is to make sure that the liver is functioning normal. And there's a lot of different enzymes that we'll look at. You'll often hear vets talk about what we call ALT, AST, ALK, or alk-phos, GGTP, TB, total bilirubin. All of these are kind of acronyms and vernacular when what we're looking at are different types of enzymes. And we're looking at the production rate of those enzymes, and a lot of times these enzymes are produced inside the cells of the liver. And if we notice an elevation in some of these, we notice then that there probably is some sort of inflammatory process that is causing the liver cells to kind of excrete these enzymes in a higher amount, and that can kind of zero us in on what's going on. It may not necessarily be a major issue. It may be something that's, the starting of what we call a hepatitis or a severe inflammation of the liver that we do need to address with medication and some other treatments to get those liver enzyme levels back down to make sure that your pet starts feeling healthy again. The next thing we look at on our blood sheet here is our friend the kidney, or kidneys, I guess, since everybody should have two of them, and your pet should as well. And we usually do look at kind of two main things when it comes to the kidneys, and the first of which is an element called blood urea nitrogen, which is kind of like a byproduct of protein being broken down and metabolized after ingestion and stuff like that, as well as another value called creatinine. And we look at those two together. They're both kind of muscle waste byproducts and protein metabolism byproducts that are normally filtered out by the kidney. And if the kidney is not functioning properly, it cannot filter these we consider them to be a toxic substance, out of the body, and then it allows them to build up and get some of the clinical signs such as nausea, vomiting, really feeling down, not feeling great, signs that we do get in animals that are developing either kidney failure, kidney disease, kidney infection, things of that nature. So if we see those values up, sometimes it can be something as simple as a little dehydration on that day for your pet. So they just didn't have a nice drink of water before coming into the vet and they got really stressed. So they were a little dehydrated. Or it can sometimes be a sign of some kidney issues going on. If we don't get that baseline information and compare everything, we may not know that. And we may have to do a lot more testing that may not be necessary if we do have that baseline in regards to kidney health. The next thing we look at is an area kind of looking at all the different electrolytes. So sodium, potassium, calcium, phosphorus, things of those natures, magnesium. We want to make sure all those are in the proper alignment, because a lot of the processes that go on in the body are reliant on normal electrolyte levels. Specifically looking at sodium and potassium, you want to make sure low sodium can affect nerve firing, and potassium levels, if they're high or low, can actually have a really detrimental effect on the heart. So if we do notice any of those values out of whack, we do want to investigate that a little bit and see, again, was it just a snapshot in time? Just that test happened to show that? Or is it something that's repeatable and that we have to look at? So we do look at all of those electrolytes as well. The final thing on most basic screens that we do look at is glucose, and the moderation of glucose, making sure that the animal is not having a very high glucose or a low glucose. We want to have that stay fairly steady, and make sure that they're not showing signs of potentially being an early diabetic or having other issues that is causing their blood glucose levels to remain very low, which can be just as dangerous, if not more dangerous, a situation than high blood glucose in diabetic people and patients. So we do check that, and we also put it in reference to other tests we've had. Cats, a lot of times, if they get very stressed, their blood glucose levels when they're pulled are actually higher, and sometimes higher than normal. But if we do have a cat that normally, tracks kind of low on the blood glucose side, let's say, and then all of a sudden, we notice that they're closer to the high end and that there really wasn't an increase in stress, that can be a cause for us to investigate this a little bit more and see exactly what we may be up against in trying to figure out what's going on. So those are all kind of the major things that we look for in the basic blood work. Again, checking the liver, checking the kidneys, checking electrolyte levels, checking protein levels, and checking glucose levels to make sure overall the picture is healthy. The other part that we, of course, include is called the CBC, or complete blood count. And what this is measuring, in essence, basically are two main types of cells, and that is your red blood cells and your pet's white blood cells. And we can get a lot of information just from this basic CBC. We want to make sure that on the red cell side, the counts, so the numbers that they have there, are adequate and where they should be, and that there's no change kind of in morphology or shape or abnormality in that case. We sometimes can actually even see some evidence of infections or blood parasites on a basic CBC, which sometimes your pet may not be showing any signs of, but can be picked up on their red blood cell counts. On the other side of it, we look at the white blood cell counts as well. And we look for basically the same things. We look for evidence of proper number, proper type of white blood cells, as there are different types of white blood cells that are out there, as well as their shape and morphology, and making sure that they don't look abnormal. Some leukemias can be present simply by catching them on a CBC, where we notice a real increase in a certain type of white blood cell, and the shape and the morphology and everything regarding that type of white blood cell is way out of whack. And that's kind of a red flag for us to say something might be going on here that your pet may not be showing any signs of. And sometimes we can catch it, like I said, nice and early, and it's not a problem. We correct it, and we know about it, and the pet goes on to live a perfectly normal life. If we don't have that baseline information, a lot of times it can lead to sometimes disastrous effects, because we could have caught something earlier. And again, in veterinary medicine, especially on the small animal side, we're very much about preventing things. We don't want to have to treat things that are really intense and in-depth if we can prevent them earlier. It saves us a lot of heartache, and definitely saves you as the pet owner a lot of heartache. And that's why we do ask a lot of times to have this blood work done. It may seem like a slightly added expense at the time, but it may actually save you a lot of money in the long run if we can find something early and treat it, and to have a baseline to this way. If your animal does get sick, we know exactly what is normal for that pet, and we can only chase the real abnormal values, as compared to trying to wonder, well, is this truly abnormal, or is it just more of the way that animal potentially is. So your vet and the technicians in your vet's office will often ask this when you come in: would you like routine blood work done? And don't be afraid to ask a lot of questions about it. Ask exactly what they're going to be checking for. Ask if maybe the type of blood work they want to run is really what the pet needs. Maybe you guys can reach a compromise and say, you know what, I understand it, but I want to go with this plan. Maybe you just had blood work done the year before on your pet, and it looked perfectly fine and it's perfectly healthy, and you say, you know what, I don't want to do it this year, but I want to do it next year. Don't be afraid to have these types of conversations. Your vet is there to answer those types of questions, and can guide you in the right direction as to exactly what tests are most appropriate for your animal at that time. So again, when you guys take your animals to the vet for the yearly vet exam, don't be afraid to talk about blood work. Don't be afraid to ask a lot of questions about what the blood work might show, and don't be afraid to make sure that you get the results and that the results are all normal. So again, this is Dr. Langlois with the Pet Pantry of Lancaster County and PVMA, reminding you once again to always take your pet to the vet, not the net.